Good afternoon. I am Rachel Hawkins with Angler Insurance, and today I have Sherry with me from Enthea, and we are going to be talking a lot about mental health and a variety of different things that are very important to you as an employer, on things that you should be considering for your health plan. We have so many vendors out there, and I think highlighting the ones that really stand out from the crowd is important. So that way you know who the ideal partners are that you should be working with. So Sherry, can you introduce yourself?
Yeah, my name's Sherry Race. I am the CEO and co-founder of Enthea. I am here and started Enthea because I am honestly tired of seeing people suffer in silence from various mental health conditions, people I know and care about, and just humanity in general. Um, and I was frustrated when I found out that there are so many solutions that are actually very effective in treating mental health illnesses, but people don't know about them, or they come with stigma, or they don't have access to them, or they're not covered by insurance, or they're not covered by your health plan. And so I'm here today to tell people about these different treatment options and what employers can do to offer them to their employees.
Perfect. So if we have an employer who is maybe utilizing mental health services, whether that it's through a telehealth app that they're utilizing them or actually through their health plan, what are some ways that your services can be incorporated with that?
Yeah, so I guess maybe first we can talk about the silent epidemic happening in the background, or what we don't talk about enough. One, a lot of employers introduced new mental health offerings to their employees since COVID. So about 60% of employers or more offered something new since COVID to address mental health, which is great. But what we don't talk about is, despite employers offering something new, most employees say they are unhappy with their current mental health offering, that they don't know how to navigate it. Most say that. A quarter of them say they don't even know if they have mental health benefits. A quarter of employees say that. And then on a more serious note, we're not seeing improvement in outcomes. So we are offering a lot of, meditation apps or telehealth or a new EAP perhaps. And I'm really excited that employers are trying to do the right thing, but we're not seeing a difference in outcomes in terms of higher productivity or better retention or lower claims costs when it comes to mental health spend, or even the other costs associated with mental health, like ER visits and cost of treating diabetes. And sorry, this is a long answer to your question, Rachel. The reason for this is because a lot of people are treatment resistant, and that's what doesn't get talked about enough. And up to 60% of people with a mental health condition actually won't get better from traditional methods. And if we take a moment and pause and move away from thinking about this as employer, employees, and insurance and health plans, and just think about the people in your life that you know that have dealt with a mental health issue, and really take a moment. Like, we all know probably more than one person in our lives that we care about that have struggled with mental health. And then think about, what did they try? And did they actually get better? Did they go on antidepressants? How long were they on them? Did they say that it cured them? Did they do talk therapy? How long did they do that for? How many therapists did they try? Did they say that cured them? And what you'll find as you go through that sort of imaginary exercise is, most of us don't know people who have gotten much better. At best, we know people who are managing symptoms, or who are learning how to cope, or who are putting band-aids on what they're dealing with, but not real solutions. And so I'm here to talk about the solutions that actually work. And it's not just my own biases that say that. I can back it up with tons of science and data from credible institutions like Johns Hopkins, Harvard, Yale, NYU, Berkeley. Some of the leading universities and hospitals in the world have done research into these different treatment modalities.
That's amazing. And I think that part of what you guys do and offer is so special because it stands out, right? And I think there comes a point where we have to start thinking about alternative therapy. One of the conversations that we've had was also around ketamine. And there's so many different services out there, but being able to fine tune it and narrowing it down and be like, well, really, what are some of the more tangible solutions that someone can actually use that have, impacts that are amazing? And there's a lot of times conversations that we don't hear the results from, or sometimes people don't talk about it. So I would love for you to shed some light on what are some of those treatments.
Yes. So, I'll share light on some. You mentioned one, ketamine. Maybe let's start with the basics. Like, what is ketamine assisted therapy? Because we hear about it a lot now, in the news, sometimes for good, sometimes for bad. We hear about it on popular TV shows. I think there was like a popular TV show on Hulu that people said talked about ketamine therapy. We hear about it on a lot of podcasts, but what is it? So ketamine assisted therapy is the use of an FDA approved anesthetic, that we have used as an anesthetic for 60 years. That is very safe. We use it in higher doses, even in children. So we've been using it for decades. We've been using it in children in higher doses. It's on the World Health Organization's list of essential medicines. And I'm stressing kind of the safety profile of this medicine because it is sometimes abused and used recreationally, and people may have only heard of ketamine through that lens. So I want to challenge people to open their mind and realize this is actually in every ambulance across the country, in every hospital, in every ER. This is a very popular anesthetic that is used. And when you use it in a lower dose in conjunction with psychotherapy, the effects are incredible. We've been looking at its application for the treatment of various mental health disorders for about 25 years. It is on average 4 times more effective than antidepressants. In some studies, people showed an 89% improvement in their mental health symptoms, which is very unheard of with traditional treatments. In one study done by University of Exeter, 80% of heavy drinkers, 80 or 86% actually, 86% of heavy drinkers were abstinent from alcohol after completing their ketamine assisted therapy protocol, even at like 1 year follow-up. It's the only medicine that we know that reduces suicidal ideation, so suicidal thoughts, in as little as a few hours, so 2 to 4 hours. And that, I'm going to pause for a second on just that last point. If you know someone who is suicidal and struggling with suicidal thoughts, ketamine assisted therapy could actually be a lifesaver. And you won't be able to help that person save their life if you don't know that it's an option. And for me, this is like the reason I'm so obsessed with pushing Enthea and educating people, because there are people out there who are sitting, contemplating suicide. They have these warped backwards ideas about ketamine, or they haven't heard of it. And this is something that could actually save their life. And so that's a little bit about ketamine assisted therapy. I'll go over maybe 1 more or 2 more treatments really quickly. Is that okay, Rachel?
Yeah, that would be great.
There's also something called stellate ganglion block, which is the injection of another FDA approved anesthetic into the voice box, which sounds scary, like you're going to inject an anesthetic in my throat. But actually you can still talk. It doesn't like disable you from talking or anything. It works on the system in our mind that's responsible, or in our brain, for the flight or fight response. And it creates this overwhelming sense of calm when you get this anesthetic injected there. And combined with therapy, like ketamine assisted therapy, combined with therapy, stellate ganglion block is also very effective for a variety of mental health disorders, but it's been most studied for PTSD, but also shown to be effective for anxiety and depression. And then there are just broadly psychedelic assisted therapy. So ketamine is to some people a form of psychedelic or a psychedelic-like substance, but there are many, many, many other psychedelics out there. Three of them have been given breakthrough status by the FDA. So they're being, fast-tracked for approval, or the FDA has recognized how powerful they are in treating mental health, that they want to get them approved soon. And those three psychedelics are MDMA, psilocybin, and LSD. And I know, I could talk all day about all of the psychedelics, but in short, I realize it's not that short, but in short, how all of these work, what they have in common, ketamine included, is they only require a few sessions. So rather than antidepressants or anti-anxiety medications or talk therapy that you do for some people for the rest of your life, for others, it's for years. These treatments that I'm referring to are unique in that you only have to do them a few times. So think about just like actually only doing something 3, 4, 5, maybe 6 times total, and then you're done. And they get to the root cause of your underlying anxiety or trauma. So rather than being a band-aid, let's address the cause of the problem. And they increase neuroplasticity in the brain. So they all work on different receptors in the brain, but they all have this thing in common where your brain is able to form new connections and new patterns and new ways of thinking. You can get out of those negative ruts. And they all decrease activity in our default mode network, which is the area in the brain responsible for all that self-talk, which is good. Like right now, I'm talking a lot. So Rachel, you probably have some self-talk going on. And the people listening to this webinar probably have some self-talk going on because I'm talking so much. And that's normal. But when we have depression or anxiety, we have too much of that self-talk. And ketamine or psychedelics reduce that self-talk. And then I think I've kind of talked a lot, but again, just a few sessions, increase neuroplasticity, decrease activity in the default mode network, and kind of getting to the root cause of things to lead to lasting change.
I love it. Now, being in Washington State, and that's where most of our clients are, even though we do have some clients that are in other states, I know that there are some treatments that members can go down to Oregon for, like you said, psilocybin and things like that. And I think that there's a variety of resources. What's the best way to actually start to take action through this?
Okay. So, ketamine is available nationwide. So ketamine assisted therapy is available all over Washington State. At Enthea, we actually, I can't say the name, but we just signed a huge, massive 10,000 live group with predominantly located in Washington State. So ketamine is available there. So is Stella ganglion block. Again, it's not a true psychedelic. It's not even psychedelic like the SGB. So that's available all over Washington State. And TMS, which we didn't talk about, but we also offer, is also available all over Washington State. The other psychedelics like MDMA and LSD are not available anywhere in the country right now. Psilocybin is the unique one. You mentioned Oregon. Psilocybin is available in Oregon and Colorado, and other states have now put some legislature in place to approve psilocybin at the state level. So like New Mexico, Iowa, I think Arkansas might be trying. They haven't done it yet, but they've like put a bill in place, I believe. But Oregon and Colorado, you can get psilocybin, which is also known as magic mushrooms, legally with someone who's trained to do it in a kind of therapeutic setting. Oregon has some language around calling it therapy. I think it's adult use of psilocybin is the word they use in a facility. But Seattle, Olympia, Tacoma, and Jefferson County, I think have all decriminalized psilocybin and natural psychedelics. So there are changes happening. what employers or people listening to this podcast can do is, of course, talk to you, Rachel, about maybe working with Enthea to offer at least ketamine assisted therapy to their employees as a benefit, SGB as a treatment to their employees as a benefit, as well as TMS. And in high acuity cases, when an employee is really struggling and nothing else has helped, especially in cases with substance abuse or alcohol misuse or any kind of addiction problems, it might be worth it, especially from an employer perspective, rather than, continuing to try rehab centers, to send them to Oregon on a medical tourism benefit with Enthea for psilocybin treatment. So that is also an option. And we do have employers located outside of Oregon who are sending, who want to send their employees to Oregon for psilocybin treatment. And that can happen legally as a medical tourism benefit.
That's amazing. I think everything that you just covered really helps the audience understand the problem of what we have going on with mental health, and also some actual tangible solutions on ways that we can help tackle it and address it. There's people suffering, and unfortunately, we don't want to see that. And so if we can shed light on all of these positive treatments that are out there and hope that it can save someone's life, that's a win. So I want to say thank you very much for taking the time today to talk about all of your services. And I hope that our audience, learn some more information. And if you want to take action, reach out to me and we can definitely get a meeting set up with Sherry to discuss how this could be a benefit for, your company and your staff and your members and their families. Any closing thoughts there, Sherry?
Yeah, really quickly, I know I talk a lot, but I do want to say that in terms of outcomes, for people who are like, okay, this sounds cool, but like, we tried this thing and that didn't make a difference, and we tried this thing and that didn't make a difference. Let me really just stress how impactful this is. We have seen an 86% reduction in PTSD, a 67, this is Enthea's data with employers, so not just like clinical trials, but actual employers who have signed up, 86% reduction in PTSD, 67% reduction in anxiety, 65% reduction in depression, and 80% of people that have completed ketamine-assisted therapy through our protocols have gotten off of their antidepressants and stayed off of their antidepressants. So I kind of want to close by just saying, really imagine offering something to your employees that can actually move the needle. Like, you've tried all these things that you thought would move the needle, but that has the data to back it up. And as a bonus last thing, if you're listening to this and maybe you're not ready for your employer to make this move, but you're struggling, or someone you care about is struggling personally, and it's not an employer decision, but it's a human decision, feel free to contact me. I'm really happy to point you in the right direction, share resources, answer questions, share whatever I can to be helpful on a human perspective. My email, if I'm allowed to share, Rachel, is Sherry, SHERRY at Enthea, ENTHEA.com. And I'm really happy to be a resource however I can.
Perfect. Thank you so much for your time today. I really appreciate you and being able to share all of the amazing things you're doing. So keep up the great work.
Thank you